Proposal of Sativex for the treatment of multiple sclerosis with patients in mild to severe spasticity. Of primary concern regarding safety is the positive relationship between the frequency of psychiatric adverse events and increasing dosage of Sativex. In order to circumvent this, each potential patient is required to undergo neurological assessment, a 4-week trial period under Sativex supervision in which those with adverse reactions can cease treatment. Majority of the safety studies are conducted over only 2 years. However, there's a multitude of studies evaluating safety in marijuana users over long periods of time, which is reflected of the cannabinoids in Sativex to a lesser and safer extent. Another primary issue is the existence of a lack of clinical trials that evaluate the safety of Sativex in population subgroups, such as those with metabolic disorders, in which it is predicted to be problematic. Here we propose the implementation of an exclusion criteria in which people under this specific subgroup will be restricted from access to Sativex, effectively eliminating the safety risk.
A few factors intrinsic to the current design of relevant trials raise objection to the application of efficacy findings. Currently, the most common approach in the determination of patient spasticity relies on qualitative subjective scales. The two most prominent are the numeric rating scale, a patient-reported scale of 0 to 10, and the Ashworth scale, which utilizes visual muscle tone to record muscular resistance. The lack of clear measures somewhat calls into question the validity of trial findings, as the subjective nature of these scales cannot wholly account for the disparities between patient reports. Though it is not feasible for us to recommend a better and more appropriate method of determining spasticity, we can advise that the methods used under regulation of the TGA be made more uniform. In this way, efficacy results may be more easily contrasted and compared between trials.